A busy life often comes with its own set of challenges. But when you start feeling a nagging pain, it's time to pay attention. Ignoring these symptoms could cost your heart dearly. Let's dive into the signs you should never ignore. John was a busy man. He had a demanding job, a loving family, and a schedule that could make anyone tired just looking at it. He often felt a little tired, but he chalked it up to the everyday stresses of life. After all, who wasn't feeling the pressure these days? One afternoon while rushing to a meeting, John felt a strange discomfort in his chest. It wasn't exactly painful, more like a tightness, a squeezing sensation that made him pause for a second. He dismissed it as heartburn from the spicy burrito he had for lunch. As the weeks went on, the discomfort returned intermittently. Sometimes it was accompanied by a shortness of breath, especially after climbing a flight of stairs. Other times he felt a wave of nausea, particularly in the mornings. John, however, was not one to complain. He brushed off these warning signs, telling himself it was probably just indigestion or a touch of the flu going around. He continued to push himself, ignoring the subtle cries for help from his own body. Life continued at a frantic pace for John. He worked late nights, skipped meals, and relied heavily on coffee to keep himself going. Exercise was a luxury he couldn't afford, and his idea of relaxation was collapsing in front of the TV with a beer after a long day. The tightness in his chest became more frequent, now radiating to his left arm. He would break out in a cold sweat sometimes, feeling lightheaded and dizzy. Sleep offered little respite as he often woke up gasping for air. Friends and family noticed John's fatigue and urged him to see a doctor. He brushed off their concerns, attributing his symptoms to stress and lack of sleep. After all, he was a man in his prime, too young to be worrying about anything serious, right? Deep down, John knew something wasn't quite right. He felt a nagging anxiety, a sense of impending doom that he couldn't shake off. Yet, he continued to ignore the warning signs, convincing himself that everything was fine. He couldn't afford to be sick, he had too much to do, too many responsibilities. It was a seemingly ordinary Monday morning when disaster struck. John was getting ready for work when a crushing pain gripped his chest. It felt like a vice was squeezing his heart, making it impossible to breathe. He collapsed to the floor, clutching his chest, his face contorted in pain. His wife, terrified, immediately called 911. The ambulance arrived quickly, sirens wailing, and rushed John to the hospital. The diagnosis was a massive heart attack. John had ignored the warning signs for too long, and now he was paying the price. At the hospital, doctors worked tirelessly to stabilize John's condition. He underwent emergency surgery and spent days in the intensive care unit, his life hanging in the balance. The experience was a wake-up call, a stark reminder of his own mortality. John realized how close he had come to losing everything, all because he had ignored the silent cries for help from his own body. John's story is a tragic but all too common example of what can happen when we ignore our body's warning signs. Heart attacks are a leading cause of death worldwide, and many of them are preventable. The key lies in recognizing the early symptoms and seeking immediate medical attention. Time is of the essence when it comes to heart attacks. The sooner treatment is received, the better the chances of survival and a full recovery. Unfortunately, many people like John dismiss the early signs of a heart attack, attributing them to less serious conditions. This delay in seeking medical help can have devastating consequences. It is crucial to remember that heart attacks do not always manifest as sudden, dramatic events like in the movies. Often they begin with subtle, almost unnoticeable symptoms that gradually worsen over time. A heart attack, also known as a myocardial infarction, occurs when the blood flow to a part of the heart muscle is blocked. This blockage is usually caused by a buildup of plaque in the arteries that supply blood to the heart. When the blood flow is completely cut off, the heart muscle begins to die. This can lead to permanent damage to the heart, and in severe cases, death. Early detection and treatment are crucial in minimizing the damage caused by a heart attack. The sooner blood flow is restored to the heart, the better the chances of survival and recovery. It's also important to remember that heart attacks can present differently in men and women. While chest pain is a common symptom in both, women may experience other symptoms such as shortness of breath, nausea, and back or jaw pain. While chest pain is perhaps the most well-known symptom of a heart attack, it's not always present. In fact, many people experience a range of other symptoms that are often mistaken for less serious conditions. Here are some common signs of an impending heart attack. This can feel like pressure, squeezing, fullness, or pain in the center of your chest. It may last for a few minutes or come and go. You may feel winded or have difficulty catching your breath, even when you haven't exerted yourself. This can occur with or without chest discomfort. You may feel pain or discomfort in one or both arms, the back, neck, jaw, or stomach. You may feel faint or unsteady on your feet. You may break out in a cold sweat, even in a cool environment. You may feel unusually tired or weak, even after a good night's sleep. It's important to remember that these symptoms can vary from person to person. Not everyone will experience all of them, and the intensity of the symptoms can also differ. Symptoms speak differently. While the classic symptoms of a heart attack are relatively similar across the board, certain groups of people may experience them differently. It's important to be aware of these variations to ensure timely recognition and treatment. Women are more likely than men to experience atypical symptoms such as shortness of breath, nausea, vomiting, back pain, or jaw pain. They may also describe their chest discomfort as pressure or tightness rather than sharp pain. People with diabetes may have silent heart attacks, meaning they experience few or no symptoms. This is because diabetes can damage the nerves that carry pain signals from the heart to the brain. Seniors may also experience atypical symptoms or have a reduced perception of pain. They may attribute their symptoms to aging or other health conditions, leading to delays in seeking medical attention. It's crucial to remember that any sudden onset of symptoms, especially if you're in a high-risk group, should be taken seriously. Don't hesitate to call 911 if you suspect you or someone around you is experiencing a heart attack. What shields you against the silent threat? While some risk factors for heart disease are beyond our control, such as age, gender, and family history, there are many lifestyle modifications we can make to significantly reduce our risk. A diet rich in fruits, vegetables, whole grains, and lean protein can help lower cholesterol, blood pressure, and inflammation, all of which contribute to heart disease. Limiting saturated and trans fats, salt, and added sugar is equally important. Engaging in at least 30 minutes of moderate intensity exercise most days of the week can improve cardiovascular health, reduce stress, and help maintain a healthy weight. Smoking damages blood vessels, increases blood pressure, and reduces the oxygen-carrying capacity of the blood, significantly increasing the risk of heart attack and stroke. Quitting smoking is one of the most impactful steps you can take for your heart health. Chronic stress can contribute to high blood pressure, inflammation, and unhealthy coping mechanisms like smoking and overeating. Finding healthy ways to manage stress, such as exercise, meditation, or spending time in nature, is crucial for a healthy heart. Regular visits to your doctor for blood pressure, cholesterol, and blood sugar checks can help identify and manage risk factors early on. Every second counts. If you suspect you or someone around you is experiencing a heart attack, immediate action is crucial. Every second counts in minimizing damage to the heart muscle and improving the chances of survival. Here are the steps you should take. First, call 911 immediately. Don't wait to see if the symptoms subside. Calling for emergency medical help is the most crucial step. Second, chew and swallow an aspirin. Aspirin helps prevent blood clots, which can worsen a heart attack. Chewing it allows it to be absorbed into the bloodstream faster. Third, stay calm and rest. While waiting for the ambulance, try to stay calm and rest in a comfortable position. Avoid unnecessary movement. Fourth, loosen restrictive clothing. This will help with breathing and circulation. Lastly, be prepared to provide information. Be ready to provide important information to the paramedics, such as any medical conditions, allergies, and medications you're taking. Remember, time is muscle when it comes to heart attacks. The sooner you seek medical help, the better the outcome. Listen to your body. John's story serves as a powerful reminder that our bodies often communicate with us through subtle cues and warning signs. Ignoring these signals can have devastating consequences, especially when it comes to our heart health. By understanding the common symptoms of a heart attack, recognizing that they can manifest differently in different individuals, and taking immediate action when they arise, we can significantly improve our chances of survival and a full recovery. Remember, listening to your body and seeking timely medical attention is not a sign of weakness, but a testament to your commitment to your own well-being. Your health is your most precious asset, and it deserves your unwavering attention and care. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends and family, and subscribe to our channel for more insightful content. Thanks for watching.